For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon. It's nice to be back with you today. I wanted to take a moment because many people have been asking, what is the California COVID story? What has been our plan from those early days through reopening to where we are now? And in order to do that, I wanted to start with a brief PowerPoint presentation, walk through a series of slides to explain that story in the clearest way. So my 12-year-old daughter, Kana, who's an avid reader, often flips to the last chapter of a book to see what it's like, how it ends. And she does that in order to decide if she wants to read the entire book. I think a terrible habit, but it works for her. The California story with COVID has not yet been fully written, so she couldn't do that here. We're really at the beginning. And we are so far proud of our collective work, but we're in this for the long run, not just the first few months, but we're in it till the end. The governor often says, let's not just run the 90-yard dash. We have to get all 100 yards. And we are committed to that, and we're confident in our approach. It's been data-driven based on the science, with a commitment to ongoing learning and adapting as we go. And we believe that's going to guide us successfully through the pandemic. We were the first in the nation to issue a stay-at-home order back in March. The work that we had in the months before that of working on repatriation flights and looking at how we can protect our seniors and our most vulnerable, to those early school closures that came county by county, to that day in March when the governor announced a full stay-at-home order statewide. And we did that for two primary reasons. We've talked about them before. One was to change our personal and community behaviors to adjust to a reality where things like masks and remaining physically distanced were going to be part of our daily life. And then also, and very importantly, to prepare our healthcare delivery system. That's not just the hospital beds that the governor has talked about eloquently, but also our PPE and a number of other things to make sure that we can handle cases as we began to reopen. And we did that all so we didn't see just a single surge, but that we were able, a single high surge, but that we were able to keep a control on our level of transmission and that it stayed below the capacity in our hospitals. And we did that so that everyone who became so sick with COVID and needed hospital level care, including intensive care unit stays, had the capacity throughout the state. And so far, we've been able to do that through our partnerships with our local partners, our hospital partners across the state, this tremendous effort to not only take care of patients with COVID-19, but those who have ongoing healthcare needs, whether it's planned or unplanned, throughout our state. And through that, we've been able to avoid that really large spike that some other states, some other nations experienced early. And as a result, we've been able to not just limit the number of people with the worst outcomes, but even improve the clinical outcomes of some of those who've been hospitalized altogether. And from the outset, we envisioned reopening as a dimmer switch. We've described it, it's not a light switch that goes on and off, it's a dimmer switch. And I like to say the governor's finger is on the dimmer switch. We're prepared to toggle back and forth, making the necessary modifications based on the data that we see, so that if we need to have more closures at one time and we can change them in the future, we're prepared to do that, all to avoid that large surge I just got done explaining. And yes, we believe the planning has paid off. We know more about COVID as a disease than we ever have. We even have a couple of effective therapies that have allowed us to have better outcomes in our hospitals. We have built up an inventory of supplies, whether it's around testing supplies or PPE or other things that have served our entire state well. And we have, again, built up sufficient hospital capacity across the state. I promise not to have too many data slides on here, but I can't help myself entirely. This slide shows what you've seen before, just in a little bit of a different form. Stable hospitalizations, stable ICU levels over courses of weeks and months. We started our reopening in late April, where the governor announced the resumption of some of the elective procedures or scheduled procedures in some of our hospitals and clinical settings. We saw that as an important first step to get the healthcare needs of millions of Californians that had been deferred taken care of, because our story has never only been just about COVID. It's been about balancing health in a broader sense. On May 8th, we announced the county variance process, and many counties, first smaller, more rural counties, applied for the variance. And then over the course of weeks, many of the counties in California matched their low transmission rates with a level of preparedness around a number of factors that we felt indicated that the local conditions could serve as one strong driver to the when, not the how, but the when different sectors reopened. Then towards the end of May, we opened more sectors. We allowed houses of worship to reopen. We had in-store retail, things like haircuts and hair salons and barbershops reopening, and a number of things opened with strict consideration for sector modifications that, if followed, we knew and believed could reduce transmission, could reduce the number of cases that we saw, and ultimately reduce the chance of a significant surge in cases. We knew shutting down the economy, we felt it all along, and our schools caused real mental, economic, and educational impacts across the state. These losses were immediate, some were very long-term, even intergenerational, and the consequences were heavy for Californians. The overall health and well-being of Californians will always guide our decisions. It's where the governor starts and where he ends. The interest of all Californians, not just in the north or the south or along the coast or inland, but all of us together, marching forward as 40 million strong, up and down together. Our goal has always been to box the virus in with clear sector guidance, over 30 different sector guidances, with detailed instructions on how industries build themselves up, return some of their openings, as well as testing and contact tracing. I already mentioned that testing capacity has grown from a couple thousand tests today, many months ago, to well over 100,000 tests being done per day across California, with an ongoing push to refine our testing strategies to make sure that they're targeted to meet this moment of many, many thousands of potential cases needing to be identified and picked up in our communities. We're looking at various modalities of testing, not just sticking with the tried and true PCR tests, but looking at new and evolving different modalities such as antigen testing and others, so that we make sure that 100,000 tests per day can climb to what is adequate to meet the needs of all Californians. Our contact tracing program is up and running. We're working closely with our local partners, our local public health partners who've been doing contact tracing for decades around different communicable diseases, that we need to continue to scale it up, and scale it up even despite the fact that high levels of transmission have made sort of traditional contact tracing impractical and difficult to do. But we are hopeful through ongoing reductions in transmission that we will soon come to a point where our building up of our contact tracing program will again match and sort of reach an equilibrium with the number of cases, and we can use it as an effective tool that we know it's been in other public health responses in previous decades, whether that's measles, HIV/AIDS, or other things. We acknowledge clearly that unfortunately our reopening has been treated as a green light to many to resume normal life. I think many of us recognize that as we have COVID-19 with us, we will be living a different sort of reality in life. That things like masks and physical distancing will be important parts of sort of our own personal responsibility in responding to COVID-19. And that despite early behaviors, which felt a lot more normal than we expected, we now need to use our dimmer switch to ensure that we get transmission rates under control as we continue to deliver strong messaging throughout the state around some of the key tools we have personally and as communities to implement to reduce spread. And this is all to avoid the ongoing increases in hospitalizations, case positivity rate, and deaths that we've seen over the last many weeks. We succeeded in the beginning because we all came together. We often talked about 40 million Californians coming together to fight COVID. I always have the privilege of talking to many of the reporters on the Zoom and many folks across California asking, are we depending too much on Californians to get us through this? And my response is, we can't depend too much on our number one asset, the people of California, to not just do the right thing, but together to do the right thing to bring this transmission rate down and to get to a place where we can not just reopen certain sectors that have been closed again, but to avoid reclosure in the future. That said, we will always have that finger on the dimmer switch. We are not afraid to use it. We are bold in understanding the science and the data to try to guide us through this. And as I said, and I continue to say, we believe because COVID-19 is teaching us new things every single day, that we not only have to be decisive decision makers and thoughtful decision makers, but we have to be open to adapting our approaches. That in order for us to be successful and have the best outcomes, we need to be great learners and understand how COVID is spreading, how it can be treated, and how we can reduce ultimately the long-term impact of COVID-19 on our communities. We will always take a broader public health view. We always have, we always will. And this means not only looking at the impact of COVID-19 itself, but other factors that impact our community's health and well-being. We've talked with our Surgeon General months ago about mental health, and particularly among young people. We know that there are consequences on our economy that are grave, and that we need to take all of these things into account as we consider our path forward and writing the next chapter in our COVID book. We will always have a particular focus on the most vulnerable, those who have been traditionally and typically overlooked in our communities. We will take care of those who are communities of color, ensuring that we get the adequate resources into those communities, that we refine our messages, that we deepen our commitment to work with our essential workforce, with all stripes of Californians to ensure that our typical messages get communicated clearly and abundantly, so we all have the tools we need to reduce transmission in our own important way. I'll end with where the governor often ends, reminding us that there are a few basic, simple things that we can do to really make a contribution in this effort to reduce transmission and win this fight against COVID. Simple things like wear a mask, maintain 6 feet of distance, wash our hands, and minimize mixing. I know they seem simple. They often aren't. They're hard to do consistently, but this is exactly what we need to do consistently. Again, we talk about the science and the evidence. I want to just end with a brief story or explanation of what we saw recently put out by the CDC. A couple of frontline workers who wore masks religiously, working with patrons, almost over 130 different patrons. They wore masks despite being COVID positive and symptomatic, and they themselves wore masks at all times. Their patrons wore masks at all times. And as this Midwestern state looked at Many dozens of those who were exposed, they didn't find a single case of COVID-19. Those same two workers, when they went home, they took off their masks, they interacted with their families, and 4 of their family members became COVID-19 positive. I think it's a proof point that some of the messaging and importance of masks need to continue to be sort of put out there and explained to a number of folks so that we can, as a state, increase our use of masks, make sure that we remain physically distanced, and do what we can to contribute to our effort, so that as we have that finger on the dimmer, that despite some dimming over the last many weeks, as we look forward to the day, and we'll only do it when we're totally prepared for it, that we raise up that dimmer, that we're going to continue to need to take those areas of personal accountability and responsibility serious so we can get through this together. So with that, I just want to thank you for your time. I know we'll have a number of questions, and I look forward to answering as many as I can.
Alex Michelson, Fox News.
Know that you're a pediatrician and a father. I'm wondering if you can expand upon the potential long-term health effects on distance learning on kids, mentally, physically, and what we can do to address that.
Sure. I think we all know that distance learning has, for many of our youngest students, been quite a challenge. What we know about development and the ability to stay focused and stay concentrated, it's challenging for our youngest students, preschoolers, kindergartners, even up through 3rd grade. And it's for that reason, the governor created an opportunity for elementary schools to get back to on-campus in-person learning sooner. And we know that as teachers interact with students, that creating curricula that are engaging and create an opportunity for kids to feel as focused as possible, that increases our chances to close some of those educational gaps that come with the loss of in-person learning. So not only is it around the educational piece, but we know that these are vital years for the youngest children to learn some of the socialization skills, how to work in teams and be part of groups. And we want to see more opportunities to be able to do that through distance learning. I know for my own kids, over the course of weeks and months experiencing it, that there were increasing opportunities to engage. So as we at the state level work with our education partners, our public health partners, and our pediatric partners, my colleagues across the state, to discover new tools to be able to increase the impact, the effectiveness of distance learning, while we know many districts are going to start that way. But it also underscores the focus on working all together, 40 million strong, to try to get transmission down so our counties can get off the county monitoring lists and we can give districts a chance to reopen some degree of in-person learning. So we're not debating the differences between distance learning and in-person learning for too much longer, but many of our youngest students, where we know that in-person presence is very critical, not just for the learning piece, but for the development piece, can happen sooner and in a deeper way.
Anna Ibarra, Cal Matters.
Hey, Dr. Ghaly. So I have a question about contact tracing. And so we've heard about counties not having the capacity to notify all potentially exposed contacts of infected people. So then they rely on people to reach out to their own contacts. And I'm just wondering what you think about this. I mean, it doesn't sound like it meets the state requirements for contact tracing. And if you can go over again how the state is helping those counties that need more help with contact tracing.
Yeah, thank you for the question. I mean, contact tracing is a tried and true method in public health. That said, at the level of transmission that we're seeing across the state, even a very, very robust contact tracing program in every single county will have a hard time reaching out to every single case. And we think that as we build up the capacity, county by county of contact tracing, that there are going to be some novel and important approaches to reach out to contacts. And if individuals themselves who have been identified as COVID positive can make that initial reach out and have it be impactful and delivered clearly, that's another important way to reduce transmission. Remember, at the end of a contact tracing program, we're not just satisfied with getting someone to pick up the phone and have the initial conversation. It really is about supported isolation, making sure that people recognize that their exposure or their positive test means that they might infect others. And that by doing certain things like staying home because you're sick or staying quarantined because you've been exposed, we can make a big difference. So we want every effective messenger to talk to a contact, to get that person to do as much of a quarantine as possible, because that's how we box the disease in. That's how we make sure the next infection doesn't happen. On what the state is doing, we've trained thousands of state staff ready to be deployed into counties. We are working with the counties to organize the information, not just on which cases that they're looking into, but also the number of contacts that are being reached. And as more and more counties come onto that database, we have better intelligence into what's happening with those contacts. We know that this is a partnership between local counties and the state, that despite us having deployable, ready to go staff at the state level, it takes time for a county to be able to assimilate them into their program, to have them as they're sort of running fast towards contact tracing, to be able to onboard those folks. So we're working patiently with the counties, trying to increase their ability to accept the new contact tracing staff from the state, but also doing it in a way that works for their communities. And you may have seen some counties are doing what I think is a wise and important thing at this moment, is not just trying to contact trace every single case, when that's not realistic given the number of cases we have today and the number of workers or staff working on contact tracing, but being pretty targeted. Looking at places like some of the essential workplaces, the larger factories and businesses that might have cases that need to be traced and understood what the transmission pattern is, to reduce it as quickly as possible. The effort that the state discussed, the governor described late last week around the focus of the state's contact tracing efforts and our disease investigation efforts to support counties with school-based cases, so that we can make sure that not only do we get to cases early, but that we make sure that they don't spread. So the state's effort is, I think, in many ways there to support the counties and to be supportive in this time when we're targeting our approach.
Kathleen Renee, AP.
Hi, Dr. Ghaly. I have a question about schools. So I wonder, what specific health information and data research is the state looking at when it determines that elementary schools, but not high schools, could potentially be eligible for waivers? And then we know that at least in LA County, there are a couple of daycares that are opening for, in-person daycare within the traditional public school campus. So what's the difference in terms of the health risk for COVID, at daycares and childcare facilities versus, in-person instruction for school? Why is one allowed and not the other?
Sure, thanks for the question, Kathleen. Overall, the decision of the state to allow the waiver for elementary school was based in, and some of you may have seen a very large study that just came out a few days ago out of South Korea that looked at transmission among young people. And it showed that the youngest kids don't transmit the disease, aren't vectors of COVID-19 in the same way that adults are, and that older students, older young people, middle school and above, actually transmit not dissimilar in some cases to adults. To get sort of deeper into the basic science, there are some markers on our cells that increase and develop over time, and those become portals to COVID-19. And so younger kids don't have as many of those markers on their cells and are thought to not necessarily get the same level of infection that older kids get. And so that means that maybe they don't shed as much of the virus when they do get it, and maybe that's what protects them in some ways. There's other theories that the size of children and how they breathe and other elements play into why they might not be as significant vectors. And so the balance between what we've said all along, that we only want to do on-campus learning when it's safe, not just for the students, but importantly for our teachers and other staff, we felt that be determined by the school superintendents or principals in the case of private schools, along with their public health leaders at the local level, that there could be a way for the youngest students, elementary school students, to return to on-campus learning earlier than the older students for the exact reasons I said. Based on your question about school-based childcare centers, there's no requirement that they open, just like many other childcare centers. There's an opportunity for those to open up now in advance even of some of the larger school settings opening up. And so with the permission and ability to do that, we know some childcare centers are going to elect to open up now. And so long that it's done according to the guidance that we've had out for many months now for other non-school based childcare centers, there is consideration for that being allowable now. And that's what we're seeing in a few different parts of the state. Certainly in Los Angeles, I'm aware of those happening already.
Josh Haskell, KABC.
Yeah, thanks, Dr. Ghaly. COVID-19 is spreading in large workplaces such as food plants, garment factories, and we know that's nothing new, but the numbers have especially jumped in the last 2 weeks in LA County. And although many of these businesses are deemed essential businesses, what can be done to stop the spread at these indoor factories when workers are on top of each other? And do you believe that some of these businesses should be shut down even though they are essential this time?
Certainly, I think there's a number of things to answer the first part of your question. First, there's a number of things that have been laid out in our guidance on how we can reduce transmission, even in some of the larger workplaces. I think it starts with the basic stuff we've talked about, wearing face coverings as much as possible, ensuring that we can physically distance even at work, making sure that we have enough hand washing stations and the bathrooms are routinely cleaned. We are preparing to put out a playbook essentially for industries to be able to that augment some of the guidance that has already been put out, so that we can ensure that factories and business owners of all sorts of sizes have the tools to be able to reduce transmission. I think one of the hardest and most important challenges is that physical spacing, and we need to be able to work. And I know our labor agency, CalOSHA, a number of others are hand in hand working with some of the largest factories and businesses to make sure that that space is available so that we can reduce transmission. Furthermore, I think it's a very important part of our strategy to not just focus on transmission in the workplace, but as I explained in the mask example at the end of my presentation, it's not just what we do when we're at work, but it's what we do when we get home. And how do we make sure that we're protecting the most vulnerable in our households, those people who might become asymptomatic vectors in another setting, so it just doesn't end at work, it carries forward as well. To your last question about whether some should be closed down or not, I think we have an enforcement arm. We have an approach where we start with compliance assistance, the TA, the technical assistance guidance that we've been putting out, but for reports of non-compliance and an unwillingness to change, absolutely, there's going to be some enforcement efforts. And I'll leave it to the enforcement agencies to describe how fast that goes. but certainly at the end, if we see a degree of non-compliance, there could be a shuttering of a business. And that might be, as we all learn, an important proof point for others to really do what they can to reduce transmission in the workplace.
Sophia Bola, the Sacramento Bee.
Hi, Dr. Ghaly. I'd like to follow up on your answer to Anna's question about contact tracing. If counties are having trouble assimilating these state contact tracers into their workforces, and as a result, most counties or many counties are not able to do the level of contact tracing that's recommended by public health experts and the CDC, should the state be having them shut down further, or what's your justification for allowing them to continue to be open at the level that they are, even though they're not able to do the contact tracing that's recommended?
Well, I think that's part of the reason why we have used our dimmer switch, right? It's this balance between continuing to build up our contact tracing infrastructure while we bring down the transmission rates through things like our dimmer actions. So we continue to watch the data very closely, and if we need to do even more with our strategies of closing, changing and modifying further, and maybe even considering other closures, we will do that. But I think it is really kind of reaching this equilibrium that as we build up that contact tracing workforce, which we are doing actively, and it's not just on the state's assistance, right? Many counties are themselves redeploying their own workers at the county level, inviting others throughout communities and different community groups to assist in the contact tracing work that they will and will continue to build up. So we at this moment are continuing to watch the data and may need to come to a point where we do more on that front. But at the moment, as we watch the data over the past week, certainly as it begins not to stabilize, but we don't see the same double digit or 50%, 30% increases in our hospitalizations, we continue to expect transmission to come down with some of the dimming actions that we made over the past few weeks, which will allow this contact tracing program that is growing to hit a space where we can contact trace more of those cases and keep the economy going at the level that it's at. But I will underscore that if the data trends turn to such a place where we aren't confident we will get there, there will be potential for further dimming in parts of the state, certainly those counties that we're monitoring closely.
Jim Root, Westwood One News.
Hi, thank you very much. I thought that I removed myself. My questions have been asked and answered. So thank you, Dr. Ghaly, very much.
You're welcome, Jim.
Brody Levesque, Los Angeles Blade.
Good afternoon, Dr. Ghaly. With the school systems looking as though they're probably going to be distance learning at least through the first part of next year, barring, of course, the efforts on vaccines and, of course, other things that are going along, LGBTQIUs who are heavily dependent on school settings and school environments through their GSAs or through peer-to-peer or through their contact with school staff, counselors, etc., oftentimes are coming from non-affirming places and are a greater mental health risk. So the first part of my question is, does your department intend to help shore up efforts in that regard across the state of California, particularly in school districts that have identified that as a source of issue, either by implementing further funding or offer some other means of highly visible support? The second part of my question, and I don't want to be being accused of being a dead subject here. I've spoken to your office, Dr. Angel. I've spoken to LA County authorities, including Dr. Guerra. We still have no numbers in this COVID crisis for the LGBTQI community. I've repeatedly asked Governor Newsom, as you know, at a couple of those press conferences you were there, are we getting any closer to having those numbers? This is apart from, Senator Wiener's bill that's currently in the Assembly. Thanks for taking my questions.
Sure. Thank you for the questions, and always happy to provide additional clarification to questions that were asked before. This is a rapidly evolving response, and so a question from a month ago asked again is totally appropriate. So thank you. On the first question, absolutely. As we look at distance learning for a number of different groups and populations, we have to be attentive to needs of young people that go beyond just classroom learning. Those psychosocial supports are important, working with our behavioral health partners at the county level, across the health system, I think is very important, making sure that school-based social work and other supportive entities are buttressed and strengthened and available to students in a distanced virtual way is going to be key. And I think we've seen a number of steps taken to evolve distance learning and distance support. And you raise a very important area of focus that we have and will continue to build on. When it comes to the data, we've done quite a bit. It's a heavy lift. It's hard work to get so much of the state to change its reporting practice. We've done quite a bit to make that happen on a number of data elements. And although we don't have it quite yet, we're working towards a time when, not just for COVID-19, but for many, many different communicable diseases, that we see transmission patterns at at the level of various groups. So I will say that it continues to be a work in progress. We continue to work hard to create that the avenue to have that data available to the state and the local levels. And in LA and across all of our 58 counties, we hope to have it soon, and we'll continue to work until we do.
Claudia Peshueta, KNX News Radio.
Hi, just a little bit of an earlier question on contact tracing, so forgive me if I repeat something, but I wanted to ask you about LA County. It's in the process of boosting its contact tracing force to 2,500 people. Do you think that's enough for an area with about 10 million residents where COVID records are being set practically daily? And then also, you spoke about the difficulties of doing effective contact tracing at the current levels of transmission. Do you think more robust contact tracing efforts earlier on might have helped California avoid this surge? And can we get updated numbers on how many state workers have been trained and given assignments, with the Sacramento Bee reporting that as of last week, only about a third of the 3,600 workers trained had been assigned? Why is that taking so long? Thank you.
Sure. Okay. I'm going to try to remember all the parts of your question. First on LA. I mean, LA is a huge county. It's what the county I call home. It's where I worked for a very long time before coming to the state. And I know that they are working hard to build up their contact tracing workforce. I think that part of the issue that we all need to see is that no one has anticipated building a program to contact trace the level of cases that we're seeing here. And I have no doubt that the 2,500 set as a goal will be increased if it needs to be, to make sure that they're able to do effective contact tracing for the number of cases that they're seeing. But the first and foremost effort must be reducing transmission, ensuring that the number of new cases comes down to a level that 2,500, even 3,000 contact tracing workers with the requisite disease investigators. And I just want to take a moment. We often focus on the contact tracers, but I think many public health leaders recognize that you need a number of disease investigators who start and initially look at the case, try to understand where the spread might have come from, where it might have led to, and then you involve your contact tracers to go out and talk to contacts, work on the messaging, make sure we're following up on isolation and quarantine. And together, those two workforces must work hand in hand to manage the caseload. And I'm confident that LA will continue to grow its workforce, and the state stands ready to augment further as necessary to make sure that as we hit that point of equilibrium where cases have come down and our contact tracing efforts have gone up, that we will be able to meet that soon. On your question regarding the number of individuals from the state that have been deployed, certainly we have a number that are ready and deployable that we're working with our counties to get into their contact tracing and disease investigation teams. And we will continue to do that until either we're out of the number of staff that we could deploy or the need is met at the local level. We've always talked about a phase 1 with contact tracing. We've met that goal. We have, together with our county and the state, exceeded over 10,000 people ready to do the work. And as we work with the counties to adjust and be able to have them deployed to do that work, we're looking forward down the road to beginning that phase 2 of our contact tracing program and having even more workers, both on the disease investigation side as well as the contact tracing side, ready to be deployed and support counties. Certainly, the early levels of case increases with every effective contact trace, with every effective supported isolation, we cut the lanes of transmission down. And as we look forward rather than just backwards, we expect to be able to have a number of people who can support our neighbors, our communities, to do what I think is increasingly important, which is when you're sick, when you're exposed, find a way while you maintain taking care of your family and supporting your community to be isolated in a way so we don't have increased transmission throughout the state.
Final question, Paul Rogers, San Jose Mercury News.
Thanks, Dr. Ghaly. Two quick things. It looks like the number of cases in California, the total number is going to pass New York's total number of cases in the next couple of days. First, I'm wondering what you think the significance of that is for California to be the #1 state in the country in terms of cases. And second, as you know, Governor Newsom ratcheted back some of the rules at businesses last week. And I'm just wondering, how long do you think it will be in terms of weeks before we see a steady drop in cases, hospitalizations, and deaths from the governor's action?
Yeah. So relative to exceeding 400,000 cases in California and just the size of the state, I mean, we're the largest state in the nation. We have a north-south sort of geography that goes well beyond Vermont to Virginia. We're not just the largest in landmass, but the most populous. So although it is not unexpected, you know, we're doing all we can to make sure that we control the rate of spread. And despite crossing 400,000 cases in California soon, I think we all look at our initial strategy of trying to be prepared for a number of days with high number of cases and ensuring that we have the surge capacity in our hospital system and all of the factors to be able to protect our communities in place. So, you know, I don't myself overread into the significance of that number. I look at every day as an opportunity to do more and do better with our response to COVID-19. And at the end, I really expect and hope that California is going to be the state that adapted the most, learned the most, prepared the best, and that we are going to really reduce its impact, not just of COVID-19, but overall on public health while we try to keep California going. In terms of when we might see the impact of the dimming actions over the last couple of weeks, we've learned that 2 to 3 week period may not be long enough. It may take up to 3, 4, even 5 weeks to feel the full impact of some of those changes that you've seen in the past couple of weeks. And we hope to be able to report as we see some stabilization in numbers that will tie it to the impact of the universal or statewide face covering directive order from the governor back on June 18th. Some of the dimming actions that you saw by moving things out indoors, outdoors, by closing some things that couldn't do that, by limiting further openings across the state and really targeting certain counties. So we will continue to look at that, and in no way, and the governor hasn't, and I won't commit to a certain date. I wish I had that crystal ball that said, this is when we're going to be ready, but we're going to continue to communicate the sort of story from on the ground, understanding how it affects the whole state, so that we don't do anything too soon, but we're also mindful of the impact of doing things too late, and trying to strike that delicate balance is what we're going to continue to do while the governor's finger is on that dimmer switch. So with that, I am grateful for all of you to joining me today, for a chance to dialogue back and forth on some of these important questions. I look forward to doing more of it. And I'll just remind you, as the governor does, that simply wearing a mask can go a long way to supporting your community, your family, and all of us to get kids back to school, to keep our businesses going, and hopefully looking forward to a day where that new reality is more comfortable and settled for all of us.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.